Hey, what's going on everyone? Dr. Ryan Balmes here, sports physical therapist with Endeavor Health. I wanted to use this quick video to answer a very common question that I get a lot in regards to how long physical therapy takes. Now, I understand where people are coming from. In a world where we're really looking for quick fixes, or when the pain is so great that you really want relief now, we're always interested in thinking and wondering, how is this going to work and how quickly am I going to get relief? Now, if you are looking for quick reliefs, there are many options out there, and there are medical options out there such as prescription drugs, prescription ointments, even over-the-counter creams that when applied or when consumed, you get immediate pain relief. But ultimately, as a physical therapist, I know that most of my patients, while they are interested in the pain relief, what they're really looking for is getting back to how they want to move, and not only move, but move well and back to where they were before. Sometimes even some of my more athletically inclined patients are not only interested in moving well, but gaining any more performance on top of where they can go. Now, to answer that question in terms of how long physical therapy takes, obviously the question is, it depends. But really, what we really should get into the mindset is understanding that physical therapy, when done right, takes time. Now look, when I was a younger physical therapist, I too was guilty of really trying to find a quick fix. I was obsessed with using manual therapy skills, and I even went to a fellowship for it. But as I've matured as a clinician, I've realized that there is just no one technique, no one hands-on technique that gets the pain gone right away for the long term. The things that I could do with my hands in terms of manual therapy and any of the stuff that we could do in clinic, whether it be electrical stimulation, ice, heat, dry needling, any of that stuff are all still small pieces of the recipe to get someone better for the long term. If you ever wondered what the biggest main ingredient for anyone to be successful in physical therapy, it's exercise. And not just any exercise, it's therapeutic exercise. And that's where really the skilled physical therapy part comes in. It's not just any exercise that you could see from a video. It's not just some exercise that you could see on Instagram. It's an exercise specifically tailored for you. You got to think about it. When you go to a medical doctor and you're getting a prescription for a drug, oftentimes they're taking into account a lot of variables to make sure it's the right dosage for you. This is very well true for the exercises that I give out and prescribe to my patients, and they're therapeutic in nature because I'm taking into account the needs for the patients and the specificity of where I could get that patient to go. So with that being said, how long it takes for physical therapy to truly work, I would say that even within the week or the first 2 weeks, we could work to get the pain down. Really get the pain so that it's not debilitating pain, where to the point that no longer is the pain really stopping you from doing your everyday activities, or for anyone at the higher level, athletically inclined, you could be able to go back to training, go back to performance without being such a nuisance or pain to the body. But when it talks about real results, real long-lasting results that you could look back and say, man, I'm really glad I did that physical therapy, you're looking at the very least 4 weeks. Now, the reason why I say 4 weeks is because the body, it just takes time, and the tissues do take time to heal. 4 weeks is the minimum amount of time that I've seen in my clinical practice where, when paired with the right exercises, you could really get the body moving in the right direction that you want to go. And if you think about it, when the body is not given any exercises, no physical therapy, no skilled guidance from someone like myself, the body will still heal in the minimum of 4 weeks. But after those 4 weeks, that body really isn't the best that it could be. So if you're interested in optimizing your recovery, really making sure that the body not only recovers, but really thrives into that recovery process, that's where physical therapy can really help you. Now, this is really important because I get this a lot from a lot of potential patients and clients really interested to see what can physical therapy do for them. You really have to get into the mindset of knowing that physical therapy will take time, but really not as long as you think. And more importantly, when you do physical therapy and you get it done the right way, you'll really get more long-lasting results. When compared to really the quick fixes that are available easily over the counter, ice, heat, over-the-counter creams, and then some of the harder stuff to get, such as prescription medications, prescription creams, or even injections, while it is a quick fix, it really rarely ever moves the needle to get you back to a long-lasting relief, and even giving you a platform to allow you to thrive and do more things that you wanted to do. I was inspired to make this video because recently in clinic I had a patient with knee pain, and just within the first 2 weeks we already got her pain down to much more manageable levels. And we got the pain down to manageable levels, so much so that I actually guided her and allowed her to really think, hey, you can go hiking on this trip that you really wanted to go to. She went hiking, and while the pain wasn't as great, she said that it was manageable, and she knew that she trusted her knees to make it on her several miles of hiking. Now, this is what we're talking about. Real good physical therapy that allows the patient like you to really get moving again. And even though it's within certain boundaries, at the very least, you can get moving and have that sense of knowing that it's going to be okay and that you have a roadmap moving forward on how to get a true recovery for the long term. So there you have it. In terms of how long physical therapy takes, at the very least, it takes 4 weeks. It's so important that you recognize that and realize that, so then that way you could take into account if, let's say, anything happens during a training block. If you get injured, you're gonna have to incorporate those at least minimum 4 weeks or longer to make sure that your expectations are realistic in terms of your goals. I say this because oftentimes, especially with the runners that I see, I always make sure, what is your training plan? Because I need to know if their expectations for recovery is going to be realistic with the goal event that they're going to have. For example, if I know that they're training for a half marathon and we're 6 months out, and if they come to me giving me at least 3 months, we can do our best to really make sure that they could still be successful to run the half marathon and even work on a little bit of performance. But if a patient comes to me and really only comes to me within the 2 weeks before an event, I'll do my best, but I'm no magic man, but I'll do my best to get the pain down. But because of how we know tissue healing and the properties and the time frame that it comes with, what we're really doing is just damage control and making sure they could still make it to the half marathon. But I always have to give the caveat that it may not look pretty, and if they're willing to run with pain, it may be something they have to be willing to do. So keep that in mind. At minimum, 4 weeks with good physical therapy to get you going for good long-term relief. This is not a knock on all the short-term pain relief stuff. Everyone deserves pain relief, but make sure you're utilizing it in a plan and using it in coordination with a good physical therapist to help you. I'm Dr. Ryan Balmes, sports physical therapist with Endeavor Health. Thank you guys for watching, and I'll catch you guys on the next one. Peace.